I have some patients that have had it, and here we are 3 to 4 months later after they've had it, they still can't go to surgery because their lungs haven't recovered.
Oh,
You know,
wow.
and they're still suffering from their fibroids and their endometriosis, and I can't do surgery on them because their lung hasn't recovered from COVID-19. And these are young, healthy patients.
Hey everybody, it's Kylie Kanzader, and I'm here to inspire you along your health journey. And today we're talking COVID vaccine, COVID shot. Do I need to get it? Do I need the second one? Am I at risk? All of that with Dr. Hawkins. And I am so excited about this conversation because I personally have had a lot of questions, even beyond just doing my research. And if you watched my part 1 video where I actually shared my journey with getting the first vaccine, lots of things and lots of factors to consider. So let's go ahead and jump into this conversation, and hopefully this helps you along your journey. All right. I'm so excited to have this conversation. And, anytime that I'm having issues or questions just around my health, I usually hit you up and ask you like, what's right, what's wrong. And I felt like it was time to really talk about this COVID shot, and specifically for like women of color, right? Like we have a very weird background when it comes to like doctors and trusting them and trusting vaccines and trusting something new. So I definitely wanted to get your insight on the COVID vaccine and how you feel about it.
Yeah, absolutely. You can ask me anything.
I appreciate that. So first question is, what is your initial thoughts around getting the vaccine?
So, I'll be honest. Initially, when the information came out in regards to the research and somewhat of the unfamiliarity of it is what made a lot of people uncomfortable. It made me uncomfortable too. And I would definitely consider myself a scientist and a believer in research and a reader of the evidence. But I also don't take everything that is put out for what it is. I think it's important for people to do their own research and read the studies. My husband is not a scientist, but honey, he knows what the COVID-19 vaccination research says. And he asks some very intelligent questions just from doing his own cursory research. So that's what I did for myself. And then I also evaluated what I felt like my personal risk is. And that's what I actually advise my patients. The COVID vaccine and the decision to get it is a personal decision, but you have to stratify it not to everyone else and what everybody else is doing and what people around you are saying, but what you feel like your personal risk factors are and the needs that are going to fulfill protection for you and your household, may it be vaccination or not vaccination. So my feelings were mixed initially. I personally am vaccinated. I was vaccinated in January. Child, I ain't wasting no time.
You're like, I'm trying to get back in these streets.
For me, it was, even though I'm not hospital-based, it was extremely important for me to feel like I was doing the best to protect myself, my staff, and my family.
I appreciate that honesty. And, I've been digging into the research too. And there's a lot more coming out now. So right now I read a study about the effects of getting COVID and having PCOS, right? I read about just, the fact that there's a lot of lung issues with individuals who actually contracted. And then the other reason why I waited a long time was the fact that when I had a mammogram set up, so I heard about the fact that there was individuals seeing lumps on their scan with the actual vaccine. So what are, I guess, some things that people need to look out for when making that choice?
Yeah. So again, stratifying it to your risk, right? So it was extremely important for you to say, okay, this is what my health status is. These are maybe some underlying conditions that I already have that might put me at increased risk, which, as you just stated, just came out, breaking news, PCOS sufferers actually are at increased risk of contracting COVID-19. So if you have PCOS, you may need to reevaluate this whole vaccination thing because your risk is higher than your friend who doesn't have PCOS. and might have their own strong opinion about it, right? And then secondly, understanding the mechanism of the vaccination and what happens, not just with COVID vaccine, for COVID-19 vaccination, but kind of just standard with all vaccination, even though it's mRNA and it's a different type of science behind it that feels unfamiliar, the outcomes are still the same. We're still building up antibodies in our system. We're still essentially mounting an immune response. So even what you said about the the mammograms and what's showing up, you're getting lymph nodes that are being essentially like pulled to arms. Like you're literally waking up your immune system, your healthy immune system, to start to make the antibodies that are going to help be able to fight COVID-19 if you ever were to come in contact with it. So that understanding of, okay, don't, shut it down completely because your friend said, oh, I got a lymph node right here after my vaccination. That's a natural response to the vaccination. And if you follow up with that friend in 2 weeks, that lymph node was probably gone. So her body did exactly what it was supposed to do. But if you don't have an understanding around it, anything is going to sound intimidating. So again, you have to stratify risk. I think that patients should look at their own personal circumstance. Am I diabetic? Am I hypertensive? Am I obese or overweight? Do I have cardiovascular disease? Do I have PCOS? Who would have thought? And then decide from there what's going to be best for you and your family.
Right. I appreciate that. Yeah, I had a lymph node and like my arm was swollen for the longest. And it was about me just like massaging it out and getting that back. So I currently am just one vaccine in. Right? So what advice would you give to somebody who gets their first vaccine, has a lot of side effects, or like what's the trigger to say, you know what, I don't need to get a second one, or I do need to get it? What's the risk there?
Yeah. So you do get some immunity from one vaccine, right? But it's definitely not maximized as far as the efficacy of the vaccination until you get the second vaccine. And honestly, until you're the 14 days out from that second vaccine. So for everybody that's on these vaccinated streets, be like, I got my vaccine yesterday. No, boo. You are not covered fully yet.
Yeah.
Right. But you do. You already have increased your barrier protection.
Okay.
You've already started to put up those blockers and help yourself get in that. So, okay. So if I can, again, share my personal experience, I was very anxious about my second vaccine. And remember, I got mine in January. So we didn't know as much as we know now about, I don't want to really call it side effects, but reaction. It's your body, the reactions people have, the fever, the lymph nodes, the soreness, even the fatigue and the neuralgia, everything. The results of the vaccination is from the immune response, right? So it's naturally what is supposed to happen, and everybody has it to different severity levels, and we don't really understand why. So we can't predict that your response is going to be different or more severe or less severe than someone else's. But that response can cause, and the knowledge of the possibility of the response can cause a lot of anxiety. And it did for me. Your girl was scared. I'm going to put it out there. I was very, very trepidatious about that second vaccine. I knew I had to do it because I was like, okay, that's a waste to do one and not the other, not get full, immunity and get all that's worth out of this science. But thank the Lord that I didn't have any side effects with my second. My second actually was better than my first. My first, I had a ridiculous arm pain, like ridiculous. And a few weeks after my second, I did get a lymph node that went away shortly thereafter. But it definitely, it's again an individual decision. I would encourage anyone that's had the first that if they have access to the second, which a lot of the vaccination clinics and sites are really doing their best to make sure that everyone that got the first that is doing a 2-dose vaccination has access to the second. I would encourage people to follow it through and don't let that fear, anxiety, stop them from getting the full dose.
Gotcha. And okay, last question. What do you feel about the different side effects that are coming out? Right. So, I've seen some reports of people being paralyzed. Of course, there's always a side effect or something that may happen when getting vaccines. So
Sure.
what's your thoughts about all
Yeah.
of that research?
So I think that you have to keep all things in perspective. So knowing about the side effects and then understanding the true risk of having any of the more extreme side effects like anaphylaxis, and with other vaccines, things like Julian Beret, things like that, that are extremely rare from vaccinations, but possible. It again becomes kind of, I don't want to preach or be like it's a faith thing, but it's hard for me to overlook the overwhelming side effects of COVID-19, like that long-term lung damage, the fatigue. I have some patients that have had it, and here we are 3 to 4 months later after they've had it, they still can't go to surgery because their lungs haven't recovered.
Oh, wow.
And they're still suffering from their fibroids and their endometriosis, and I can't do surgery on them because their lung hasn't recovered from COVID-19. And these are young, healthy patients. So for me to be afraid of the 1 in a million chance that I might get one of those severe side effects, and understand that if I get COVID-19, my risk of long-term side effects from the actual infection is times greater. That possibility of that one bad reaction from the vaccination, for me, that's me putting things in perspective. I would rather not suffer from the long-term side effects of the infection than be worried about the possibility that I might, by off chance, get that 1 in a million side effect from the vaccination.
Oh, goodness. So true. And, I just appreciate your honesty. You always come with your own personal experience. And, as a woman who honestly, it has had difficult conversations in the past with doctors, I just appreciate that from a doctor's perspective and you just being open and honest about that. And okay, second, I said that was the last question, but one more question. Your thoughts about overall vaccination. So for me, as a mom, I remember when I had Clay, I was just like, okay, I need to do all my research about vaccines and trying to figure out if I made the right decision or, how am I doing this? Because at the end of the day, we live in a society where he has to go to school. I have to go to work. What is your overall, I guess, process of knowing which vaccines to get and which vaccines not to receive and just overall health for yourself and your family?
It's hard. I think it's a hard decision. And as mothers, we realize that one, we're our children's best advocate, right? They can't really speak up for themselves. They really can't make the decision with any type of knowledge or discernment, right? So we have to do it for them. So I appreciate you even adding this to the discussion, because so many women that will watch this are mothers and may struggle with that same decision making. For me, I'm a simple girl. It's not really even about trusting the science, but that is actually what it ends up coming down to. But I trust my providers. I trust my pediatricians. I myself am not a pediatrician, and I don't say that blindly. I seek out pediatricians that I think are trustworthy. I actually had a doctor when I delivered my children in Baltimore who was not like, do everything. Like, just, if it's the thing that can be done, do it. Dr. Starr was like, oh no, baby, we're only doing what's necessary. And we're doing it for this indication. We're doing it because your child has, my oldest son has reactive airway disease, so he might need it. My youngest son, he might be okay. There have been years where I haven't done certain, like flu vaccine or different things, because the science said this year, and is this one actually going to be protective, and is it worth it? Those are the type of doctors I trust. The doctors that aren't like, oh, it's just easy to say, do what's in the textbook, because what you learned in the textbook 15 years ago might not be relevant today. I trust the doctors I choose, because I choose doctors that I know are going to, one, be in the best interest of me and my child, and two, are not going to casually decide how they manage the care. That's the type of doctor I think I am. I don't casually take, anything for my patients lightly. I literally treat each patient as an individual and cater the options and the management to them. And that's what I want for my child too. So I put myself in the care of people that I trust, providers that I know will not misguide me, because I don't expect my engineer daddy to read the scientific research the same way I might. And I'm not going to read the pediatric research the same way my pediatrician will, nor will he read women's health the same way I will. So
Yeah.
for me, that is what I've, honestly decided for me to do. I put my trust in the providers that I pick, that I handpick, because I trust their guidance, and they have a good reputation for treating their patients as individuals.
I love it. Thank you, Dr. Hawkins. I appreciate you taking this moment this morning. I know you have a busy schedule, and I just am thankful for you to just share your wealth of knowledge and expertise. And of course, you can always come back on here anytime you're ready. And you guys definitely go follow Dr. Hawkins. And please, Dr. Hawkins, really quickly let everyone know where they can find you.
Absolutely. So I am Soyini Hawkins, and my IG is Soyini Hawkins MD. On Facebook, the name of my practice is Fibroid and Pelvic Wellness Center of Georgia. And then, of course, you can always just good old www.getfibroidhelp.com, and I'm here for you. And, I want to make sure that I do reiterate, getting the vaccination is a personal decision. Nobody should be shamed or not supported or criticized for making that personal decision either way. I support my patients with either way they make their decision, and I try to support them in that decision that they make.
I agree. All right. Thank you, doctor. I'll talk to you soon.
Thank you for having me.
Whew. All right, guys, I hope you enjoyed that video. Dr. Hawkins is such a gem. I absolutely love her, and I love the fact that she is a Black woman who has endometriosis, fibroids, and is currently helping so many women through that journey. One of my biggest takeaways from this conversation is that you're not wrong no matter what decision you make, especially if you've done your research, you figured out what was right for you. So with that, here's to living healthy your way, and I'll see you next video. Peace.